One thing that I don't think that a lot of people can say is that they truly love their job. I love what I do. I love coming to work every day, and I think that's an amazing feeling. I love the people that I work with. I love helping patients. It's just a great feeling knowing that this really doesn't feel like a job to me. So we're just gonna get clocked in here real quick. Hey, good morning. All right, so I always start my morning by coming and look at these boards. These have all of our cases for the day and what our assignments are gonna be. So there's a lot of good information on here. So here's my name. So this is saying that I'm gonna be in room 12. I'm gonna be working with Dr. Peterson. Esther and Nico are my surgical techs, and Drew's gonna be assisting. It tells me where my patient is in same-day care and what nurse I'm gonna get report from. So we're gonna work in 12 today. So we're gonna go over here and scrub our hands so we can get started. So at this moment, while I'm scrubbing, I always start thinking about what I'm gonna need for my cases throughout the day. That way I'm kind of in the right mindset to make this a very efficient day for my surgeon and my teammates and the patients. Okay, we're going in. All right, so this is kind of how we come into the room every morning. We have a crew that will terminally clean the room for us every night. And then the night shift crew, they've brought the case card in, they've laid out some of our instrument sets, they have our appropriate table in here. So we're just kind of in a good place when we come in the morning. Okay, so this patient does have a few allergies, so that is something that we're gonna have to look at, that we might make a few changes depending on what their reactions are. Okay, so we got our x-ray orders in, looked up our patient. So I'm gonna go over here to our case cart. So all of our instruments and supplies will come on a case cart. All of our cases will have a procedure card. And we have a different procedure card for every surgeon for every case that they do. So this is just kind of a guide of what instruments you need, what their preferences are, what supplies you would need for their case. This is just a great resource for someone who's not familiar with this case. It's kind of my job to make sure that the surge techs are ready to go, anesthesia's ready to go, the surgeon's ready to go, and the room's ready for the patient to be wheeled back. So when I go pick up the patient from same-day care, I have very limited time for when my patient's awake, because they'll be back when they're in the OR, they're already gonna be sedated in some capacity. So I have a very short amount of time where I can develop a good rapport with them and start to gain their trust that I'm gonna take great care of them. So this is same-day care. They have assignment boards just like we do, so we're just gonna go double check that nothing's changed since we looked earlier. So we can still see that we are going to be in room 17 with Amy. Good morning. All right, so we're doing a spinal today, is that correct? Okay, so what's gonna happen here, it's gonna get bright and chilly as we head back. Once we get you in the room, we'll get you set up on the side of the bed, we'll get you hooked up to our monitors, get you some warm blankets, and then we'll get to work on that spinal. All right, well, if there's no questions, I think we're ready to roll. All right, here we go. Let's get that hip fixed up.
Good morning. Yes. How are you? Good.
All kinds of good helpers in here just for you.
I'll be back.
We're going to go to PACU 3. Howdy. This is Gloria. She goes by Sue. She had a left total hip replacement with Dr. Peterson. She received ANSEF 2 grams and TXA pre-op. She received a spinal. She received the local injection. Her left hip has Dermabond, Aquacel, and ice. EBL was about 200. She did a wonderful. She's a retired nurse too.
Oh, okay.
Yeah, she has a husband here with her. All right, on to the next one. So it's seriously a great feeling that she has been having this hip pain for 10 years. And now we just essentially changed the quality of her life by doing this hip replacement. So just makes my heart happy that her life is going to be so much better from here on out. Yeah, so we're just a big team when like in all aspects of the surgery. So nobody's too good to clean. We're all cleaning. The surge tech, she's dropped off the case part and decontam right now. And so she'll be back to help clean. So we have to wipe down the light, we have to wipe down the bed, we have to wipe down all the tables, and then we'll start it all over again. Okay, so it is, let's see, 3 o'clock. We have, in my room, we've done 3 anterior hip replacements, and we've done a total knee. And then our last case that is going right now is a total knee revision. They'll still be working when I get back, but it shouldn't be too much longer after that. That will be finished. All right, this has been the day in the life of an OR circulator. Thanks for following me and hanging out with me for today. Now I'm out.